Hi, this is Dr. Brian Gardner, podiatrist at the Uinta Basin Medical Center, and I will be giving you your post-op instructions. So first, after surgery, typically most people's feet are numb. If your foot is not numb, please notify your nurse and they can give you pain medicines. Typically the numbing lasts anywhere from 4 hours to sometimes a day and a half. So do not panic if your foot is numb still a day and a half after surgery. Second is ice. Typically ice can be very helpful for controlling pain and swelling. Typically the cold does not get through the bandaging, so it's recommended that you put an ice pack behind your knee 15 to 20 minutes every hour following surgery. Make sure that you do not leave the ice on there continuously to get frostbite. Next is the bandages. Typically, the bandages are to be left clean, dry, and intact. Typically, when most people shower or bathe, they will wrap a leak-proof sack around their surgical foot. If your bandages do become accidentally soaken, then please remove the bandages. Have someone go to the store and purchase gauze and an ACE wrap to cover the surgical site once again. Also, it's normal to have bleeding into the bandages following surgery. If you notice spot bleeding on the bandages, don't panic. If that happens, do not remove the bandages. Simply go and buy another ACE wrap and gauze and reinforce the current bandages. But do not take the initial bandages off. Next, with bandaging, occasionally the bandaging can become tight as your foot swells following surgery. If you are taking pain medicines and it does not feel like it's controlling your pain, sometimes that can be caused by an overly tight bandage. Please do not remove the inner bandaging, but you can loosen the outer ACE wrap, and if you do have a post-op shoe or boot, you can also loosen the straps on these devices. Next, we will talk about pain medicines. You should have been given some narcotic pain medicines before your surgery. Several things to be aware of with pain medicines. First off, it's important to realize that pain medicines do not completely take away all of your pain. They simply will dull the pain. If you do not feel like that it is resolving your pain at all, please notify me and we will switch to a different pain medication. It's very important that you understand that the pain medicines need to be taken as prescribed. Taking more than is prescribed or taking pain medicines with alcohol can result in death. It's also very critical that you understand that pain medicines can cause dizziness and drowsiness. So you should never be driving while you're taking narcotic pain medicines. Narcotic pain medicines can also cause constipation if it's taken in a long term, so sometimes an over-the-counter stool softener can be helpful. Also, if the pain medicines seem to cause nausea, an anti-nausea medicine taken at 15 minutes prior to taking your pain medicines can definitely help control the nausea. Next, we will talk about smoking. It's important that you understand that smoking is very detrimental to healing following surgery. Smoking during the post-operative regimen can cause delayed wound healing and bone healing. So please avoid any smoking during your post-op recovery period. Next, we'll talk about blood clots. Blood clots are a potential risk of any surgery. Signs of a blood clot would be sudden onset of calf, thigh, or groin pain and swelling. Also, a sign of a blood clot can be a sudden onset of shortness of breath. If you do experience any of these things, please just go directly to the emergency room. Next, we'll talk about infection. Any surgery can potentially result in infection in the surgical area. Infections usually do not set in till about day 3 to 7 following surgery. If you begin to experience increasing redness, swelling, and pain in the surgical site, that might be signs of infection. Also, severe fever, nausea, and vomiting 3 to 7 days after surgery can also be signs of infection, and please notify me if this happens. Next, following each surgery, certain surgeries, it's not you will not be allowed to weight bear on certain surgeries. If you do not understand if weight bearing is allowed following your surgery, please notify me or the nurse. Weight bearing following a surgery where it is not allowed can result in a poor surgical outcome and potentially the need to do a revisional surgery. Next, if you do not have a follow-up appointment within 4 to 7 days following the surgery, please contact my office so that I would like to see you at about day 4 or 5. The phone number is 725-FOOT or 725-2025. Also, when you leave today, you should be given some discharge instructions. On these discharge instructions, there's an emergency contact number. Now, if you have a question and it's during normal business hours, please contact my office, 725-FOOT, and ask for my nurse. We will answer those questions. But if it's after hours or on the weekends, the emergency contact number is 725-2026. If that will get you into the emergency room, if they cannot answer your question, then they will notify me and then I can call you back. If you have any other questions, please feel free to notify me. And thanks, and we'll see you soon.